Hi, and welcome to your second hour of Ethics, titled Guest Ethics Part 2, brought to you by allceus.com. In this segment, we're going to define multicultural counseling. We're going to examine ethical considerations with respect to multicultural counseling, briefly touch on issues related to counseling children and adolescents, and discuss issues surrounding end-of-life counseling. So let's start with multicultural. Again, a lot of terms. I will try to make this as entertaining as possible. So culture broadly means association with a racial or ethnic group, as well as with gender, religion, economic status, nationality, physical capacity, or sexual orientation. Culture we can think of as broadly that environment, that encapsulation that a person lives in and interacts in, derives their values from. We need to consider that. Don't get hung up on exactly each one of those, and if it's not one of the things I mentioned, gender, religion, economic status, yada, 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 then it's not culture. That doesn't necessarily hold true. The whole purpose is to conceptualize culture as what it is. How do you define culture? And what is a culture to you? It's a group who shares similar mores, values, principles. Ethnicity is a sense of identity that stems from a common ancestry, history, nationality, religion, or race. Minority groups refer to any category of people who've been discriminated against or subjected to unequal treatment and oppression by society, largely because of their group membership, which part of the thing that allows or perpetuates some of these groups to be discriminated against is they are smaller in numbers. So a minority group is one that's been discriminated against. That's kind of what you want to remember and not, again, get hung up on numbers. We're looking at a group who is regularly the underdog. Multiculturalism is a generic term that indicates any relationship between and within two or more diverse groups. Multicultural counseling is any counseling relationship in which the counselor and the client belong to different cultural groups, hold different assumptions about social reality, and or subscribe to different worldviews. Now, I don't know about you, but a large majority of the clients that I work with are multiculturally different or diverse from me. And I learn a lot from them. But it's important for me to recognize my values and separate those from the client's values because we're operating from the client's worldview. Diversity refers to individual differences such as age, gender, sexual orientation, religion, and physical ability, among others. Anything that makes us different, diverse. And it could be a whole range of things. Again, for the third time, don't get too hung up on specific definitions. Look at the spirit of the term. Diversity means differences. Diversity-sensitive counseling is a concept that includes age, culture, disability, education level, ethnicity, gender, language, physique, race, religion, residential location, sexual orientation, socioeconomic situation, and trauma. Again, that list is not all-inclusive. Diversity-sensitive counseling means we meet the client where they are, start to try to understand their worldview and what their hopes, values, and ideals are compelling them to do. We need to be sensitive that a flip comment in our culture may not be received as well in their culture, that some things aren't as easy in their culture as they are in ours, or vice versa. So constant awareness of these things. For example, working with people who are elderly, people who are my grandmother's age. Whole different set of values and mores and social etiquette and everything else. So a whole different approach to working with her than to working with someone who's 22. need to be cognizant of those and design your interventions appropriately and view the world kind of through that lens as best as you can so you can understand their perspective. Culture-centered counseling is a 3-stage developmental sequence that goes from multicultural awareness, knowing that there are different people out there, to knowledge and comprehension. Okay, let me learn about those other cultures, ideals, values, etc. To skills and applications. Now that I know about it, how do I actually use it in practice? Stereotypes are oversimplified generalizations about individuals who are identified as belonging to specific groups. You see a blonde-haired, blue-eyed female, and there are certain stereotypes that just pop into some people's minds. They are very oversimplified generalizations. You see a, I don't know, perfect one that my husband always razzes me about. You see a woman who happens to have 5 cats. Yeah, a lot of stereotypes go into your head. But are those always necessarily true? So we want to really check our stereotypes at the door. Just because somebody's a doctor, a lawyer, a dock worker, a banker, a fill-in-the-blank, a politician, doesn't necessarily mean that they're going to conform to this global stereotype we have. It gives us a point to start at, maybe, based on our prior learning experiences, but we need to approach each individual as an individual. Go figure. Racism is any pattern of behavior that solely because of race or culture denies access to opportunities or privileges. Enough said. Multicultural counseling is based on the following premises. All cultures have meaningful ways of coping with the problems a particular group faces. Native Americans, African Americans, white Americans, poor Americans, old Americans, whatever. They have, each of those groups may have their own different little issues or big issues, but as a culture, they figured out ways to deal with them. People seek counseling largely because of problems that emerge out of sociocultural conditions. Something broke. And the society, the culture has not necessarily figured out a way to make it mesh, where the larger society may be conflicting with the smaller culture. Traditional counseling is a particular form of intervention developed in the West to cope with psychological distress. Now, why is that in here? Well, to highlight the fact that traditional counseling isn't the norm everywhere you go, that it isn't necessarily even the norm in America. There are certain populations who think therapy is fashionable. There are certain populations who think therapy is something to not be discussed. You need to be aware of your client's worldview. You need to help them mobilize the resources that they feel comfortable using to be happy and healthy. So if that's developing more social support systems, if that's working through their church, if that is working through an elder in their community, whatever it is that their community has developed as a way of solving problems is going to be useful to mobilize in helping that client learn how to meet his or her continuing needs and goals. The culturally encapsulated counselor, the one who's kind of isolated, shows insensitivity to cultural variations. They show a lot of stereotypes. They're not sensitive to people as individuals. They're not sensitive to the impact that a person's culture brings to the therapy session. They are characterized by accepting unreasoned assumptions without proof or ignoring proof because that might disconfirm their own assumptions. They don't want to be proven wrong, so they don't want to hear proof. Well, is that how we really want to be in the session? So we need to be open-minded, about all different things. Failing to evaluate other viewpoints and making little attempt to accommodate the behavior of others. Now, this is not only multicultural, but just in counseling. When you have a person in front of you, they very well may have another viewpoint. By all intents and purposes, you may have very similar cultures. You may be very similar, but they still may have very different viewpoints. So you need to talk about that. And you need to be able to try to understand their behavior. And I always drop back to, what was the motivation? What was the benefit to that behavior? What were they hoping to achieve? Because again, I believe that most people are good, forward-moving, positive people who are doing the best they can with the tools they have. So looking at the meaning and the function of the behavior often helps me understand. Actions are trapped in one way of thinking that resists adaptation and rejects alternatives. My counseling style, my reactions, my willingness to work with certain types of clients. Those are all actions that can be trapped in one way of thinking if I'm encapsulated. So constantly evaluate your own behavior and the motivations for it. Moral and professional responsibilities regarding diversity. We need to be aware of our own biases, stereotypes, and assumptions, and the biases, stereotypes, and assumptions of those working in our office. If you have front desk staff, if you have people coming in, if you have other counselors working in your office, whatever the case may be, when people come to counseling, they need to feel it's a safe place. And we need to make sure that we communicate that in everything we do with the client, from how we handle their insurance claims, to how we deal with them in session, to how we schedule appointments. We need to be aware of the culturally different clients' values and worldview. Just because they walk into your office doesn't mean you can look at them and go, okay, I know your values and worldview. They may not even really know that yet. I mean, they have an idea, but maybe part of what they're coming to counseling for is to sort out their own values with regard to certain things. It's up to you to ask questions. We need to develop appropriate intervention strategies to take into account the social, cultural, historical, and environmental influences impacting the client. We need to get continuing education and reflect on the underlying values of our chosen therapy models. All right, let's look at some common assumptions requiring attention in multicultural counseling. It's important to remember that self-disclosure isn't always something that's prized. In many cultures, self-disclosure reflects not only the person, but the whole family. And it's strongly discouraged to self-disclose to a stranger. So we need to ask ourselves, if a client is appearing guarded, what does that mean? What does that mean to that client in the frame of reference of their worldview? Assertiveness and directness are not prized in all cultures. Individual autonomy and self-actualization are values only held by a very few cultures. A lot of cultures value interdependence. And nonverbal behavior such as personal space, eye contact, handshaking, dress, perspective on time, and formality of greeting differ between cultures. Educate yourself about those very basic things when you're working with culturally different clients. If you know you're working in an area that has a large Hispanic population, educate yourself to the common cultural things that they do. I'm not finding the right word right now. Is it appropriate to shake hands? Is it appropriate to make direct eye contact? How much personal space is expected? When you meet somebody for the first time, how formal should your greeting be? And what is appropriate for them to call you? You know, some cultures are okay calling a therapist by their first name, some cultures not. Sometimes it depends on age. So be aware of just the really basic social mores of the cultures that you're dealing with to at least get you started on the right foot. Development of attitudes and beliefs which are positive towards multiculturalism. Helping people understand that they are awesome who they are. Understanding how one's values and biases might get in the way of effective helping. You know, I'm not going to shock anybody when I say that I'm pretty darn opinionated, but I know what my opinions are, and I regularly work to keep them in check when I'm working with clients, especially regarding certain issues. When I'm working with a client on an issue that I have strong feelings about, you know, I do let them know that I do have strong feelings, but what we're working at is helping them identify what their thoughts and feelings are. But I also seek supervision. It's really important to make sure that we are serving our clients without letting our own biases get in the way and prevent us from helping them achieve what they are trying to achieve. We need to be knowledgeable about our own worldview. Okay, I was raised, I had all these experiences, and that has made me who I am. What does that mean? What is my worldview? What do I believe about people? What do I believe about power? What do I believe about sharing? What do I believe about all this other stuff? And it's important for me to know that, so I know what may or may not impact my work with clients. Have specific knowledge of the diverse groups with whom you work. Again, basic research will help you out. Working with a client, a counselor who often works with those clients is also helpful. Seek consultation. If you're working with somebody from a different culture, that may help bridge that gap from your knowledge to actually implementation of effective skills and practices. Have a basic understanding of socio-political influences affecting those groups. Is there something going on that may be affecting that group right now? And again, don't lump too much, consider it, but then look at the individual person and go, okay, they're part of this group, but am I overgeneralizing by saying they're being oppressed or endangered or stressed out by what's going on? And appropriately use skills and intervention techniques and strategies necessary in serving diverse clients. If clients have English as a second language, then giving them all their material in English, not real culturally sensitive. Give it to them in a manner that they can best receive the information and use it. Use techniques that are more appropriate for certain groups. Some groups are not going to feel comfortable, some cultures, again, since sharing all your stuff to strangers is not necessarily prized, going to a large 12-step meeting and getting up in front of 50 people and telling your stuff may not go over so well. So make sure you're aware of what things may hinder your clients from using interventions and what alternatives there are. And there may be other 12-step alternatives that are culturally appropriate. Just be cognizant. Multicultural perspectives must be integrated throughout a counselor's developmental curriculum. Ideally, trainees should participate in at least one internship where you have multicultural experiences. But if not, then at least look at things from a multicultural perspective. Take certain scenarios that you're having or certain cases and change up the culture, change up the facts a little bit and role play it in the supervision setting. That's not perfect. It's really better to work with a diverse group of clients. Trainees should educate themselves to other people and other cultures through reading and travel. Now, I hate to travel. I like my routine, but I will read. I will learn. I will talk to people. Thankfully, we don't live too far from a metro area where there's a lot of diversity. Figure out how you can educate yourself to the diversity, especially as it pertains to your little microcosm of the world. Important counselor competencies regarding values and spirituality. You need to understand the relationship between religious, spiritual, and transpersonal phenomena. So, religion, pretty self-explanatory. Spiritual tends to be conceptualized as larger than one particular religion. And transpersonal, across, personal, people, across people, phenomena. How your religion and your spirituality affect how you impact and interact with others. Identify how key events in your life, in the counselor's life, contributed to the development of their belief system. Engage in self-exploration of their religious, spiritual, and transpersonal beliefs that support or hinder respect and valuing of different belief systems. If you believe that it's your way or, everybody's going to hell, that's probably going to hinder multiple perspective taking. You need to understand where some of that comes from, what you prize, what you believe in. Honesty, hope, faith. What do you have faith in? Integrity. What does that mean to you? What things did your spirituality or religion teach you? Do you believe that fate controls everything, or do you have some personal responsibility for how your life turns out? A lot of those questions should be covered in that section on the assessment under spirituality, but you also need to ask yourself those questions. Demonstrate an empathy for and understanding of various religious, spiritual, and transpersonal phenomena. You have the big ones. In our area where I work, Christianity and Judaism are huge. There's a little bit of Muslim, and there are some other religions that are out there. Now, religion is only religion. There's also spirituality. People who aren't necessarily tied to a particular religion. It's important to know how your clients think and how they view the world and how they interpret these things. You're not going to get that in an assessment. You can start, but all of this is going to unfold throughout counseling. And you need to open your ears. Close your mouth and open your ears and try to figure out or understand that client's worldview. Acquire knowledge needed to better understand the client's religious and spiritual worldview. I just recently moved from a place where the Hare Krishnas were very, very prominent. And that was a different worldview than I had been exposed to. I'm not saying right or wrong, I'm just saying different. And so when I was working with patients who happened to be Hare Krishnas, I had to do a lot of research to try to understand some of their traditions and worldviews, belief systems, etc., in order to better serve them. Assess the relevance of the religious, spiritual, and transpersonal domains in the client's therapeutic process. It's not always going to be about spirituality. Assess how their spirituality, transpersonal phenomena, and their religion is impacting their presenting issue. Ultimately, it's about the presenting issue and where they want to be in 3 or 6 months. Use the client's phenomena in pursuit of therapeutic goals. Whatever strengths they have, use those and build on them. Identify when their understanding or tolerance of meaning the counselors, understanding or tolerance of religious, spiritual, or transpersonal worldviews is insufficient to adequately serve the client. Again, going back to my work with the Hare Krishnas, there was a point when I first started working with them that I said, I need to get some more education because I cannot adequately serve you. I was working with one client on her marital relationship, and that was just a whole realm of learning that I had to educate myself about before I could adequately and competently work with her. And Seek consultation or further training and demonstrate appropriate referral skills when the clinician's own limits of tolerance or competence are reached. So again, in this particular situation, she had a lot of stuff going on that she felt needed to be handled by a licensed professional. She sought me out. She wanted to stick with me, so we worked in consultation with her community, her spiritual advisor, to develop treatment plans and to help me understand where they were coming from. So moving on. It's not always about adults. It's not necessarily always about culture. Children. Another one of my little pets here we're going to talk about. Not that children are pets, but my pet peeves. Minors are a special client population. Distinct education, training, and supervised practice are ethically required for counselors. Unfortunately, to the best of my knowledge, there's no state that requires counselors to have specialized training to work with minors. That's my pet peeve. Because working with a 5-year-old is very different than working with a 25-year-old. You can actually do harm by working with a 5-year-old in the same way you would work with a 25-year-old. So in my mind, I think we should have some laws that sort of govern that. We govern who can do hypnosis, who can do sex therapy. We govern who can do counseling, but not who can work with children. Okay, off of my soapbox. State laws pertaining to confidentiality with minor clients are not uniform. So again, know your state laws. Seek legal consultation if necessary. Review state laws pertaining to counseling children prior to working with youth. That way you know what releases need to be signed and what information you may or may not have to disclose, so you can make an informed choice about whether to work with a minor. And you have to know how and when to make abuse and neglect reports. It doesn't matter if you're working with kids or not. If you happen to learn about child abuse and you have reasonable suspicion, you have to report it. You're licensed. So it is important to know how and when, under what circumstances, you have to make abuse and neglect reports. Parents are entitled to general information from the counselor about children's progress in counseling in most states. However, informed consent of parents or guardians may not, I'm not saying it isn't, I'm saying it may not, be legally required, check your state laws, when a minor is seeking counseling for drugs or narcotics, for STDs, for pregnancy and birth control, or for an examination following alleged sexual assault of a minor over 12. Now these change and they vary state to state. But it is important to know which circumstances you may not be required to get consent from parents. It is suggested that the family be included in a minor's counseling. Well, yeah, we know that a kid is partially the product of the environment in which he or she is raised. So it's helpful if we can involve the family. It is suggested that counselors involve parents in the initial meeting with the child in order to arrive at a clear mutual agreement regarding the nature and extent of the information that will be provided to them. If they walk out of there thinking they're going to get to read your progress notes every week, you may have a big problem if that's not what you agree to. And generally that's not advisable. It's a good policy to provide minors with treatment alternatives and to enlist their participation in defining goals for therapy. What is it you want to get out? A lot of times kids are there involuntarily. Mom and dad said, I have to come. Okay, that's fine. You have to come. How will you know when you don't have to come anymore? What problem do your parents see? All right, what can we do about that to get them off your back? Because ultimately, the kid wants mom and dad off their back. To get mom and dad off their back, they're going to have to do what mom and dad want. We can go down that road. Use motivational interviewing to arrive at mutually agreeable goals with the client. Ensure you communicate with children in a developmentally appropriate manner to empower them throughout the process. Don't use jargon. Don't use big words. Don't talk down to them. We want to empower them. Ask them what they should do. If they are old enough, I mean, a 5-year-old has thoughts and opinions, and a 15-year-old definitely has thoughts and opinions. So ask their opinion and then talk about it. Remember that children are people, go figure, but they're not little adults. If they're still in that mode of cognition where everything is black and white, pre-operational, operational, you're going to have to interact differently than someone who is able to take different perspectives and see shades of gray and anticipate consequences. It's also important to remember that depending on any developmental issues, the child may chronologically be 15, but may only be information processing at the level of a 10-year-old. Be sensitive. And be sensitive to the culture that adolescents, and I use that term pretty broadly, are experiencing in middle and high school. There's a lot of stuff that's different now than when you and I went to school. Texting, sexting, lots of peer pressure. Seems like there's a whole lot more bullying. A lot of different influences. I mean, most of us remember high school is not the best time in the world for the reasons that existed back then. So yes, those may still exist. We need to understand what it looks like for a 16-year-old now. And moving on to end-of-life counseling. Most of us will not do end-of-life counseling, but if you happen to be a pastoral counselor or involved with hospice or working with someone who has a loved one who is dying, or maybe you have a client who wants to continue working with you even though they have been given a terminal diagnosis, these issues may come up. Now, I will preface that by saying it is extremely important to seek supervision and legal consultation when we're talking about a lot of these issues, because you don't want to overstep your bounds or fail to report something that you are legally required to report. That being said, end-of-life counseling generally occurs when a patient is at the point of hospice care. Whether they're involved with hospice or not, they're at that point where they've got 6 months or less to live. May involve helping the client explore options for advanced directives. Do they want to have life support withdrawn? Do they want to have a do not resuscitate order? What is it that they want their end of life to look like? It's vital to involve the entire clinical team, and when possible, you know, again, just because it's end of life decisions doesn't mean we don't need releases of information. When possible, involve the family in the consultation decisions. So let's talk about some of these things that may come up. Rational suicide. It's a misnomer for some, but in this particular sense means the person has decided without coercion from others, to end his or her life because extreme suffering involved with a terminal illness. You can rationally see the reason why this person wants to do this, and there is no hope of a cure. Aid in dying consists of providing a person with the means to die, but the person self-administers the death-causing agent. Now, counselors, we're not going to get involved in that, but it is important to be aware of the term. Hastened death involves speeding of the dying process, which can entail withholding or withdrawing life support. And that can include breathing machines, food, medications, what have you. So, is suicide or hastened death rational? Well, we want to look and consider these things. Is the person considering suicide, do they have an unremitting and hopeless condition? Have they been given a very short period of time to live? Is the person acting under his or her own free will? Are they able to make decisions and informed consent? Has the person engaged in a sound decision-making process that includes consultation with the mental health professional, us, and discussions with objective others, including medical and possibly religious professionals? They need to talk with their doctor about the actual status of their case. And they'll probably talk with you about what's going on. And hopefully they will get the input of other people who are important in their lives. It's helpful if you can find out as much as possible about the course of the client's illness, prognosis, and available treatments. If the doctor says, nope, there is nothing we can do, it's just a waiting game now, that's pretty self-explanatory, and it's up to the client how they want to proceed. Know the client's family support systems and their views regarding end-of-life decisions. Some families may push in either direction, so it's important to understand what pressure the person is feeling. Realize the client at or near death needs help coping with psychological and physical pain. That whole existential anxiety, as well as depression and a whole host of other things. You can only imagine what you're dealing with when you're sitting there dying. So it's important that we assume the role of a resource person. Help the client understand the importance of various personal and formal documents. Offer compassion and acceptance, and understand that are related to the difficulties in dealing with life and death issues. They may feel one way on Monday and completely different on Tuesday, and that's okay. And realize the role of offering comfort to loved ones and friends after death. In summary, most of us are going to counsel culturally different people. Be aware of and respect cultural differences. Be familiar with the differing needs of people at different stages of life. During the final stage of life, some of us will have to help people process their end-of-life decisions. And above all, be aware of local laws and regulations and know how to help people develop advanced directives and be involved with a consultation team during end-of-life counseling. Thank you, and have a wonderful afternoon.